So this is 5:30 in the morning, and we have a workshop camp. Today we booked up for about 5 surgeries, and we'll be having a few doctors that will be training and getting things rolling. Once again, man, thank you so much, and we're looking forward to more engagement in the future.
You're most welcome.
All right.
You won't be seeing us the last time for sure.
All right. Then. So this is 5:30 in the morning, and we have a workshop camp. And what happens is we have to take all our supplies, including the machines, carbon dioxide, the team. So we're just packing up our stuff, and we'll be rolling out. And this is how we do it when we have a workshop. We take everything we have. We have a few medications here. Go hopefully that we're going to make a difference and touch some lives. Well, today's I think is more of a workshop. So our intention is to go and train. We are pro capacity building, so I don't know how many patients booked up, but maybe on average 5 patients for the day. So there's a team of a few doctors who have invited us. They've really been interested, so we're only going to support them. And we're taking everything. Maybe 5 patients will benefit from this today. Take everything, including this is carbon dioxide cylinder, and this can give us up to 15 patients. So man, it's a full hospital, man. We call this mobile hospital. So we got everything we need.
Few moments later.
Hey guys, we are already at Kiambu Sub-County Hospital, and you can see we are already changed up and geared up to go. Today we booked up for about 5 surgeries, and we'll be having a few doctors that will be training and getting things rolling. So tag along. We had a great opportunity to be at Kiambu Sub-County, and thank you to Dr. Sema who gave us this invitation. I think this is something that we've been trying to work out for a very long time, and I'm so glad that it kind of worked out this time. So what was your experience, Dr. Sema, with this workshop?
I think it was a good experience. It was more of a learning opportunity. Of course, laparoscopy is always about a learning curve. And the more you do, the more you learn. Okay, it's not a question of the more you read. So we've basically learned a lot from you, from the theory aspect of it to the practical aspect of it. And we are hoping that this is not the last time that we are having this opportunity to learn from you, right? And from your whole team.
Yeah.
We've learned the concept of teamwork. It's not just about being a single person entity. So yeah, that was a very good opportunity for us.
All right, so we feel that you guys, your case selection was really good, and having your team here and getting started this wagon for minimal invasive surgery, which is something personally I felt that there's been a huge need in this country particularly, and I think the biggest challenge is getting surgeons trained, and having this workshop, I think, to me has been some of the things that I've always been looking forward to.
We are serving a very low income community, so that is something that has to be taken into account. But we feel that actually it's something that the county needs to come up also very strongly,
right,
and support the doctors and the hospitals in general to be able to come up and set up the minimal access surgery. It will be of a lot of benefit in terms of patient recovery, the cost at the end of the day, because the hospital stay is very short. The training may be a bit expensive, but at the end of the day, you find that the amount of money that will be saved, if you look at it retrospectively, having trained a lot of surgeons, will be lesser than what we are spending currently.
And you see, I've been a true believer that the patient that should benefit from minimally invasive surgery, and actually studies have shown this, would be patients from low to middle income countries, because these are patients who cannot afford to have so much of lay time from work.
Yeah.
These are patients who are living on wages. These are patients who are taking care of their family. They don't have insurances. Unfortunately, we find that's not the situation here. It's more of laparoscopy has been for those who actually have good insurances.
Exactly. Yeah.
And the cost for it is just crazy enormous. So I think this is something I feel that we both share in bringing minimal invasive surgery to the Mashinani, and that's what Mashinani, laparoscopy Mashinani has been all about. So very thankful that you had us here, and for me it's always been a great opportunity for me to get to travel and to give back. And as we've always said, this is a baton we give you, we train trainers. So hopefully next year we'll be having a team that you'll be training. But once again, man, thank you so much. And we're looking forward to more engagement in the future.
You're most welcome.
All right.
You won't be seeing us the last time for sure.
All right then.
All right.